Okay, today we are going to look at the specific areas around the neck and face and look at all the different options we have for what is often called non-surgical facelift. Now, I'm going to actually discuss a few types of treatments here. So we can look at each client individually to see, what is the skin laxity, what are the objectives you're trying to achieve, and see what are the combination of treatments that we need to use to get you looking your best and looking the way that you want to look. So I'm going to start by looking at the neck itself, and then we'll go up the face and onto the forehead. So a lot of people, as we age, the skin around the neck is very thin, and especially for many of us who've had short hair all our lives, the back of the neck has often taken quite a beating from the sun. So we would often start with a EMS treatment, and we specifically have EMS pads for the neck. So these would go around the front of the neck. It's also possible to put them around the back as well. And what this is going to do, the combination of radio frequency to help tighten and resurface the skin, as well as tone the muscles around the neck. If we move up from the neck, we can look at the sort of Submentum area here, and we've got EMS pads which we can put under here, which will help to with the fat that tends to gather down here, as well as it wraps around, it helps to tone the muscles here, which is commonly called the jowls. And then we have pads for the cheeks, for the eyes, which I have shown previously in some other podcasts. And then we have the forehead as well. The forehead is a really interesting one because as it tones the muscles, it can also help to lift the brow as well to give a brighter, more toned look, both of the forehead and of the eyes. So depending on which area we need to treat, we can adjust the pads in terms of where we put them, the number we use, the duration, the intensity, both the intensity of the EMS pulses as well as the intensity of the radio frequency. So that would be the sort of core, going at the muscular area from the collarbone up. And then depending again on the results we're looking to achieve, we would look to move towards an ultrasound or a HIFU type treatment. Now, the HIFU treatments come in many different size heads. These particular heads, which I like because they cover a lot, we get sort of 12 lines of coverage and 12 shots in each line. So they're a really, really good way of ensuring that as we move it a few times around the face, that we're able to cover every particular area. We can go vertically as well as horizontally to ensure that we've got the right matrix. And again, for this, we have many different depths. So we may start in certain areas if we need to really go after the fat in the neck area, sort of upper neck, maybe around 4.5. We can then raise up a bit closer to the surface of the skin with a 3. And then for the more general resurfacing and from the collarbone on up, we can use a 1.5. We will adjust the intensity based on, again, the results we want to achieve, the pain threshold that you have. And then for both the EMS and the HIFU, we would be looking at a few treatments, most likely, depending on the laxity of the skin. EMS you can do more frequently. The HIFU, you need to have several weeks of break in between. So you may do a few EMS treatments over the course of a month or two. We would then do a first one and a second HIFU treatment. And then again, if we're looking at the sort of resurfacing of the skin and how do we want to get the collagen and elastin fibers really so that we can see the actual plumpness and the benefit of this, we would go to radio frequency with microneedling. So we have both radio frequency heads without microneedling. So this would be called surface radio frequency. And then we have different heads that we would use for the microneedling. So again, this would be to look at specific areas where we're really trying to tackle laxity of the skin. We want to give that bright glow. There is sometimes a little bit of downtime with the radio frequency if we're using the microneedling. because depending on how deep we go and the intensity we use, it can puncture the skin in certain places. It can leave a certain amount of redness. So again, we'll adjust this based on the needs and the outcomes that you want to achieve, as well as, of course, looking at your pain threshold. And let's see which combination of these treatments and how many of them you would need in order to have that healthy glow that you're looking to achieve.